All right, why don't we get started? My name is Bill Arnone, as I said. Welcome to all of you for the webinar that is the rollout and release of our latest report of the COVID-19 Task Force's Policy Implementation Group. You have access to the report in the last invitation that you received, and we look forward to digesting it after you hear kind of a high-level summary today of the report's contents. And we'd love to get feedback from all of you on the report. The usual Zoom Q&A function at the bottom of your screen is where you can submit questions. But let me begin by just outlining the agenda. We're going to begin by opening remarks, we hope, from Naomi Stanhouse of the RF Foundation for Aging. She's having trouble getting in. Then we will begin to look at the contents, the key findings. Catherine Baker, Provost of the University of Chicago, will be kicking us off with health security findings. Henry Aaron, Senior Fellow at the Brookings Institution, will then look at the income security findings. And Diane Schanzenbach at Northwestern University's Institute for Policy Research will look at food security. And then Louise Shaner, our principal investigator, who's done an extraordinary job, will take us through the top policy options. And remember, in true Academy style, our reports outline policy options, we analyze them, but we don't make recommendations ourselves. But I'll talk about a follow-up where advocacy organizations will have a chance to take the findings and advocate for those that they wish to emphasize. So why don't we do this? Let me turn it over, Kate, to you. And if Naomi joins, we'll just split and just have her say a few words. I do want to acknowledge the RF Foundation for Aging as the lead funder of the work of this task force. We also receive funding from Arnold Ventures, Elevance Healthcare, Kaiser Permanente, and AARP. So thanks to all of them, RF Foundation for Aging being the lead sponsor. So with that, Kate, let me turn it over to you.
Great. It's wonderful to get to share the results of this report with all of you. And I'll be relatively brief because Henry and I will take you through some of the top line findings, but Louise will really go into detail. And Diane will take you through the findings on food security. So first, I wanted to start just by thanking our committee members. You can see their names in the report. This was, a wonderful volunteer effort to pull together some really important findings that we hope will inform national policy going forward. So I'm really grateful to have worked with all of the people on the team and to Louise especially for all of the heavy lifting on this report. So our task was to examine the way the social safety net functioned as it was originally constructed and with the additions and changes that were made by Congress to address the pandemic and real-time modifications to try to address some of the shortcomings. So we wanted to examine how well that functioned, as well as think about what the lessons and options might be for policymakers going forward, either to modify the existing program or to think about making more automatic some of the changes that were made that were really beneficial to protecting individuals and families. We started, of course, with the core social insurance programs, thinking about Medicare, Social Security, and one of the big worries was that the pandemic would speed the financial insolvency of those programs. And that worry turned out to be somewhat unfounded in that because there was a reduction in healthcare used by people during the pandemic, and because payroll taxes rebounded much more quickly than anticipated, there was not a major negative impact on the trust funds for those programs. That said, it did highlight vulnerabilities of those programs to changing economic conditions, and we wanted to highlight that for policymakers to think about future policy changes. Diving into the health side, which is my area of focus, the pandemic was unquestionably an enormous health tragedy for so many people in the US and around the world, and it was very disproportionately felt based on pre-existing limitations in access to care in areas that were underserved in disadvantaged communities. So that is the overarching thing that we take away from the pandemic, of course. But Uh, I think there were some successes of the social insurance program that we can highlight. We did not dive in any detail to the public health system, which clearly has, many challenges and much more data was needed. And I think there are lots of opportunities for improving the public health response to COVID. That was a little beyond our purview. So of course we mentioned this, but our goal was to focus more on social insurance programs themselves. And we saw a lot of successes, mostly because of quick responses to people who, by policymakers, to make sure that people who lost insurance gained new access to enroll, to ensuring that there was more flexibility in the delivery of services, like opened channels for telemedicine and more reimbursement for those. But we also saw some real opportunities for improvement, either in making some of those changes automatic. And that could be not just in the case of pandemic, but could be for any national emergency or economic downturn. There could be some automatic triggers for those programs. We also saw how important the digital divide was in all things for education for kids, for example, but here for access to care, always for people in underserved areas or in rural areas, but in particular during the pandemic when so much care turned remote, we ended up seeing the amplification of the digital divide. And this highlighted the importance of having broadband access as a health measure, as well as for access to all sorts of other resources. Offices, enrollment processes on many social insurance programs were severely hampered by the closure of offices because of the pandemic. So, it was very hard for people to enroll in programs like SSI or disability programs. Unemployment insurance overwhelmed states. Henry will talk a little more about that. So it highlighted the shortcomings of those systems, especially under strain, and the return to ongoing investments in those. There was also data missing that would have helped a lot of responses. We didn't have available to us automatic enrollment in some programs based on pre-existing data, for example. We weren't able to target benefits as well as hoped because we didn't have data on key parameters or key populations, people who hadn't filled out tax returns. We didn't have tax day, eligibility for tax credits, for example. So having better data, not just to support the public health function, but also to support better targeting of resources would allow us to act more quickly and act in a more focused and financially sustainable way. We also saw that for efforts to improve, provide providers with some financial backstops when many providers were very worried about the long-term consequences of a dramatic change in the payer mix as people moved from private insurance to Medicaid, and as people stopped using discretionary services, there were additional payments made to providers that were very valuable in many cases, but were also not as well targeted as they might have been with better data. So thinking about how to implement the data infrastructure to support better decision-making and more focused benefits could be of enormous value. So I will stop there on the health side. I will turn it over to Henry to go into more of the details on the income side.
Actually, Kate, before we ask Henry, we're patching in Naomi Stenhouse the old-fashioned way through a cell phone because of a bad connection. Naomi, as I said earlier, is with the RF Foundation for Aging. They were the prime funder. And Naomi, thank you again. Just a chance for you to make a few comments about your perspective on this report.
Okay, thank you. So talking about the digital divide, this is just digital difficulties, I guess. So just want to thank you, Bill, and the National Academy for the honor to say a welcome on this important occasion. And so RF Foundation for Aging is proud to be one of the funding partners on this project. And just a few words about who we are. We're a national independent foundation, a grant-making organization dedicated to improving the quality of life of older people. And so achieving economic security in later life is one of our highest priorities as we strive for a nation in which all older people have the means to achieve a secure and dignified retirement. To accomplish this, we need a stable national retirement system that provides the support, services, and protections older people, indeed all people, need to achieve basic economic security. So we have a particular interest in the impact of COVID-19 on the U.S. social insurance system and in identifying ways in which core programs can better protect people in times of national economic crisis and in preparation for what we know will be the next such an inevitable crisis. We supported this policy research with the goal that it will generate practical knowledge and guidance that you as policy researchers, advocates, policymakers can use to improve the social insurance system for all people. From RF's perspective, the pandemic shined a light on the health and financial hardships of older people, especially people of color, who are disproportionately low income and who depend on Social Security and Medicare as the foundation of their economic security. But we appreciate that the pandemic revealed cradle to grave economic and health inequities and long-standing racial disparities. The crisis emphasized the need to assess our social insurance system's funding adequacy, benefit coverage, and equity challenges to ensure its fiscal stability and redress inequities. And this is what we hope the National Academies Project has done. It's essential that the lessons learned and the recommendations made in this report not just sit on a shelf. It's up to all of us to use the report and the upcoming accompanying advocates toolkit to determine which are the most feasible of the policy recommendations to promote, and then to put our collective muscle behind them. So thanks again to the Academy, and on with this important information.
Naomi, thank you. Thank you for your remarks, and thank you for the challenge, which we know we need to meet in order for this to have an impact. So we deeply appreciate that. Let me now turn it over to Henry Aaron to talk about some of the income security findings. Henry?
Yes. Thank you very much. I'm very happy to be associated with this project, as the result is a very fine report, chock full of information, also full of practical guidance on how to improve our already formidable social insurance system. Credit for this goes, as has been mentioned and will be mentioned again, I'm sure, broadly, to Bill Arnone, who is the CEO of NACI, for showing the entrepreneurship of undertaking this effort, to the RRF Foundation that helps support it, and the other financial supporters as well. But I will also want to have a special shout out to Louise Shaner, who you will hear from presently, who oversaw the work of a number of expert panels, including dozens of national experts on various aspects of social insurance, and who added enormously to the quality of this report. Indeed, is responsible for its real creation. That said, I want to start by emphasizing that this report is written by a group of policy wonks. We are, as a group, trained to take a look at things as they are and find ways in which the current system isn't operating as efficiently as it might do. In the case of COVID, there were, as the report documents, ample areas in which the system responded imperfectly. But the overwhelming conclusion that should be taken away from this report and from examination of the role that social insurance played in combating health and economic losses is that the system worked. It was a smashing success in insulating Americans from income loss and from the consequences of illness. The system as it existed before COVID required real-time action by Congress to supplement various aspects of the system, to fill in gaps. And in a large number of ways, Congress acted promptly and effectively to do so. We talk about a number of shortcomings. The overwhelming takeaway from this report should be the story of the success of social insurance in protecting Americans from the ravages of COVID. Now, Kate has said a few words about healthcare, and Diane Schanzenbach will tell about food insecurity. Louise Shaner will talk about practical steps that we recommend moving ahead. I want to speak just briefly on the income support side of our social insurance system, which happens to be the lion's share of it. Let's start with Social Security itself, insurance for the elderly and for people with disabilities. That program pours out nearly $1 trillion a year in aid, and that aid continued uninterrupted throughout COVID. It did not require significant legislative change in order to fulfill its functions, and indeed was instrumental in enabling Congress to provide additional aid because of the administrative resources available at the Social Security Administration. The key here is that Social Security and other forms of assistance not only provided direct relief to those who received checks or who were enabled to buy food or other aspects supported by social insurance. The key aspect is that in addition to those benefits, the fact that people were able to continue spending meant that those who had retained their jobs continued to retain them because demand for their goods and services were sustained by the cash assistance that social insurance provided. Now, there was one glaring exception to this story of the fundamental success of particular programs. Unemployment Insurance Administration, long in need of reform and long in need of legislative amendments to its design, buckled under the burden of an enormous tidal wave of new applications. Fortunately, Congress stepped in and provided a very large backup of funding to enable the expansion of unemployment insurance to 13 million additional beneficiaries and allowed a quintupling of payments under the program during the COVID epidemic. As with Social Security, the direct beneficiaries were, of course, helped. But in addition, those suppliers of consumption goods that the beneficiaries were enabled to continue buying kept their jobs and kept their businesses afloat because of this aid that flowed to them. Now, there were significant failures. I've just mentioned one of them. The absence of data, something that Kate mentioned just a moment ago, is worth taking a special look at. We didn't know in many cases who was suffering, where they were located, and how really to get to them. But the result of this was a kind of paradox. Because we weren't able to target in this particular case, Congress was forced to provide lump sum benefits, large lump sum benefits to the vast majority of the US population, cash assistance checks. The result was low-income people who, if aid had been carefully targeted, might well have received a fair bit less than they did, received larger checks, even as those with relatively high earnings and who might have received more assistance as unemployed, if we were able better to target benefits, probably received somewhat less. So inadvertently, the failure of data made the system of assistance more progressive than it otherwise would have been. I could go on, but I won't, because you need to hear from Diane Schanzenbach about what was done to assure continued food security. And you need to hear from Louise Shaner about what we should be doing now to prepare ourselves to enable our social insurance system and the rest of our society to be prepared when the next health crisis or natural disaster or international conflict threatens our national welfare, as some such event surely will during the lives of most of us who are listening to or participating in this webinar. Thank you very much. I'll pass it back to Diane.
Thank you very much. I was really honored to be part of this panel. I'm very grateful to the National Academy of Social Insurance for organizing and spearheading this work. I also want to echo the deep gratitude to the chairs of this committee and also in particular to Louise Shaner for her just heroic work on all aspects of this report. So in the food security side, what happened was the pandemic highlighted weaknesses and holes in the current safety net, just like it did in income support and in health. But overall, it revealed also that there's great strength of both social insurance and of the safety net to respond to the emergency. I also give a lot of credit to Congress for making some really smart policy changes in the midst of the emergency to help families in response to this unprecedented shock. So I'll briefly go over the three big programs that were used to leverage responses to the increase in food insecurity and the increased risk of food insecurity. Starting with SNAP, which of course is the largest program in this space. I wanted to mention that there were some really smart innovations that were done during the pandemic. In particular, we knew that because the economy went south so quickly, that new people would need to be on the program, but we didn't need to be wasting our precious resources on recertifying existing cases because almost no one's incomes went up. And so Congress agreed to extend recertification periods, which freed up administrative capacity while we were all social distancing and struggling with transitioning to work from home. That was a really smart idea. They also allowed for more remote processing of applications such as telephonic signatures and other things that might make sense to continue as we have an increasingly digital world. Also, they provided more federal support for the increased state administrative costs, making sure that those barriers weren't holding back families' ability to get additional resources. And of course, they also suspended the work requirement time limit that affects some people who are on SNAP. The work requirement time limit, its effect is debatable when the economy is strong, but it is clearly counterproductive during economic downturns. And it was smart to remove that. Now, I'll also mention that they increased the benefit amounts in a manner that was appropriate for the emergency, but is probably not appropriate for normal policy. So what happened was usually people receive benefits that are a declining share of how much money they have. But during the pandemic, everyone received the maximum benefits. What this did was save administrative burden of getting adjustments. If you lost money during the pandemic, you didn't have to go back to the office and say, I need an adjustment. Everyone got that adjustment automatically. But on the other hand, it didn't give any additional resources to those who were the poorest, who also suffered under COVID. What we saw is participation as a result of all of these innovations increased. It increased quickly by about 17% and has stayed elevated since then. It really demonstrates that SNAP can respond quickly to a crisis. Now, due to these policy changes, SNAP spending more than doubled. But I'll be quick to note that the new SNAP spending, even though it increased, by 100% or so, was only 9% of the new spending on the combination of economic impact payments, the unemployment insurance, the child tax credit, and SNAP that was done in those first 2 years of the pandemic. I'll also mention that there's new research that looks at what happened when those policies went away at the end of the pandemic, and those happened differentially across states. And what we learned from that is that rates of food insecurity and insufficiency increase when we sunset those, and that other economic hardship increased, like inability to pay rent, et cetera, and that we didn't see any change in employment. So SNAP was a real success, and it points us to some ideas about potentially lowering barriers to either participation or recertification going forward. And we brought up another idea, which was to pick from this bundle of responses that were done during COVID, especially regarding work requirements, and either try to implement automatically a suspension of work requirements during economic downturns, or authorize the USDA secretary to implement changes without states requesting waivers during public health emergencies. And then we also wanted to flag and raise for consideration changing the appropriations language around SNAP from a fixed dollar amount to something such as such sums as necessary, so that this important program isn't hampered by delays and by potential ceiling crises. More briefly, with school meals, of course, school closures did substantial and likely lasting damage to children. As the recent NAEP test scores show, we lost decades worth of academic progress during the pandemic. Food is sometimes overlooked in this, the role of schools. Their school feeding programs are extremely important. And so when schools were closed, they rolled out a brand new program in the midst of the pandemic called Pandemic EBT, Electronic Benefit Transfer Cards, that are used like SNAP benefits to families who lost access to free or reduced price school meals. Studies have shown that these payments reduced food hardship among children and their families, and really shows, I think, the highlight of investing in infrastructure for getting these dollars out quickly to children and their families. Since the report was finalized, this program, the Pandemic EBT, was made permanent during summers and school closures going forward, which I think is a real improvement in current policy, and I think will help us address food insufficiency in children, especially during the summers, which we know has been a persistent problem. And then finally, the WIC program, which targets young children and pregnant and nursing mothers. Participation in WIC increased much less than it did for SNAP or for Medicaid. And it's hard to disentangle, understand why this happened. Some of it was certainly driven by a decline in the number of births that we saw. But some of it, could have been about barriers to access. And so again, this highlights participation challenges even in good times, and especially as children age. So we highlighted in this report, the potential need for things like performance metrics to make sure that states are adequately reaching out to their potential WIC population and bringing them onto the program in an efficient and effective manner. So overall, great successes from this aspect of the social safety net and social insurance, but many things that we can build on going forward. Thanks.
Great. Okay. All right. So as you probably recognize, but no one has quite said it, the report goes through many different aspects of our social insurance system and really documents what happened, what changed, what we know about the consequences of the changes. And so even just as a historical document that really kind of goes into the details, as Henry said, we're all policy wonks, so it really goes into the details of the programs. I hope it is useful to many of you to document, hey, we tried this, we tried that. It contains almost 50 policy options covering this wide range of programs. And so I'm not going to obviously talk about all of them today, although I'll mention a whole bunch of them. The policy options can be viewed very, very broadly as falling into two buckets. One, options that would build on the successes of the pandemic era programs, and two, options that would address the failures or limitations that became apparent during the pandemic. And I think of those as having two sub-buckets. One, places where we know our social insurance did not perform as well as we would like. And then areas where we just don't really know how to evaluate how well we did. And so areas for both collecting more data and also for more research in a lot of cases. Okay, so let's start with building on the successes. So as people have all talked about, the social insurance system was significantly expanded during the pandemic, both in terms of the generosity of benefits and in terms of eligibility in many ways. I think it's really important to start with this recognition that these expansions were not something that we typically do during recessions. They were really unprecedented. So for example, we raised the unemployment insurance benefit by $600 a week for the first 4 months of the pandemic, and $300 a week later. In the Great Recession, we raised UI benefits by $25 a week. So vastly different. We made gig workers and other people who would typically not qualify for unemployment insurance eligible for UI. That's never been done before. We had a continuous enrollment required for Medicaid that kept people from losing their health insurance, similar to what Diane was just talking about on SNAP. We basically said, if you had it before, you get to keep it. That's also very new. We really didn't know what the consequences of this would be, right? So it's not like we could have predicted completely. Especially the experiment in UI was really an experiment. And so what did we learn, right? So I think, overall, as people have talked about already, a more robust social insurance system can, by and large, prevent recessions from leaving lasting scars on family finances, right? So that is really, really important. Many times when people go through a recession, they come out of it scarred. They have bad credit ratings. They've lost their home. They've lost jobs that they can't get back. The social insurance system both supported the macroeconomy and supported households and families and left them in better shape. The other thing is, we found there's quite a bit of empirical research says that particularly during times of high unemployment, like the beginning of the pandemic, you can have very high unemployment insurance replacement rates, as we did, without significant effects on employment, right? We didn't know that was going to happen. We could have said, oh my God, you're giving people $600 extra a week. They're never going to go back to work, but they did. So that suggests that, we can have higher UI replacement rates than you would think. And even during times when labor demand was strong in the summer of 2021 and before the benefits expired in some states, there were disincentive effects, but they were certainly smaller than many would have predicted. Okay. So broad expansions of UI eligibility are also possible. We saw that we included gig workers. We included many people. There was some fraud, but by and large, it was a very helpful expansion. So that's possible. Making it easier to retain Medicaid helps prevent people from losing insurance. And this isn't just because people who lose eligibility are able to retain insurance, right? Of course, if you don't kick them off and they're not eligible, they're going to have insurance, but also because administrative barriers in normal times lead eligible people to lose health insurance. So I'm talking about that administrative barrier when it comes to Medicaid, But as Diane mentioned, it's true for food stamps, it's true for very many programs. So we know that small little barriers can really lead people who need help from not getting it. We relaxed those during the pandemic and found out that you could really do a very good job by relaxing those. Okay, so these findings lead to many, many policy options. I'll give you a few on UI and a few on Medicaid. So in UI, and again, these are policy options, so we have many of them. You don't necessarily do both of them. So one, we could just increase replacement rates for UI, perhaps as a rule. So UI replacement is lower in the US than it is in other countries. Maybe we should just have higher UI replacement rates. So if you lose your job, you do better regardless of the economic conditions at the time. Or you could say, well, no, what we learned is that maybe you want higher UI replacement rates when unemployment is high, or maybe for those with low earnings history who really need the money because the UI replacement rates don't give you very much money when they're low. So that's one option. So let's just think about replacing them. Two, we can think about ways to increase eligibility for UI or a UI type program, which in normal times excludes many low-wage workers and part-time workers and the self-employed, new labor force entrants, and workers who leave their job voluntarily. And there are several ways to do this discussed in the report. And one way you could implement these changes is to increase the federal role in the UI program, because this is basically a program that is set by states, perhaps by paying a share of UI costs in states that meet some minimum replacement rates and eligibility criteria. One thing that we haven't mentioned that we do talk about in the report is how we really do have 50 social insurance programs, because there is a lot of variation across the states. And that variation is related to race, so that it looks like, African Americans tend to have lower UI replacement rates than others because of the states they live in. And so we kind of focus on that in a number of programs of how you might want to increase the federal role to increase equity across the states. Options for Medicaid. So we would think that we know that there's a lot of churn in Medicaid because people lose eligibility. You could require states to guarantee 12 months of continuous coverage regardless of changes in income. So you get on Medicaid, you get to stay for a year. If you don't want to do that, you could make it easier for states to do that. Right now, states who want to do that have to get a waiver. You could get rid of that process and lower the bar for states who want to do this. You could reduce administrative barriers to enrolling in and maintaining Medicaid coverage. Again, perhaps by barring states from requiring premiums or co-payments for Medicaid, or by doing things like expanding the use of navigators to help people sign up. These policies could boost rates of health insurance, as well as reduce health disparities across race and ethnicity. As we mentioned, some of our policies that we said, well, maybe we should make them automatic. So one of those policies is to make the increase in the federal share of Medicaid, the FMAP, automatic. It should automatically increase during downturns. This not only provides aid to states during downturns, but it also discourages states from trying to balance their budgets by making cuts to the Medicaid program, because the federal share is going to increase and it's not going to be the most efficient way to cut your budget. Making it automatic would ensure that it will happen in each downturn. Now, Congress has done it a number of times, but it's not clear that they will do it the next time, and also could tailor the duration of assistance to match economic conditions. So this likely would have lengthened the duration of the higher FMAP during the Great Recession, but probably shortened it relative to what actually existed during the pandemic. So there are many other programs in the report, and we talk about all of them and what recommendations we have. Diane discussed the policy options for SNAP and WIC. We talk about the child tax credit in the report. We talk about the eviction moratorium and other housing programs as well. And I'm not going to go into all of these because I will run out of time. So now let's talk about some of the shortcomings. So I'm going to talk about 3 buckets of shortcomings. There are more in the report. One, poor health outcomes and increased health disparities as a result of the pandemic that could have been avoided. As Henry mentioned, lack of administrative capacity that hampered the pandemic response, and lack of sufficient data to target benefits and evaluate social insurance performance, and shortcomings related to the effects of high unemployment and high inflation on Social Security and Medicare. And so policy options related to poor health outcomes and health disparities, I kind of just went through reports and culled them and pulled these ones out. So we know that outcomes at nursing homes were very poor, and that many nursing home workers are not vaccinated. And so one thing you might want to do is require nursing home workers to be vaccinated for COVID-19 and other infectious diseases like the flu. That would improve resident health. And given that Black residents are more likely to reside in nursing homes with low vaccination rates, would help address racial disparities as well. We already talked about the digital divide. As we said, that could help. Telehealth is very, very useful and will be more useful in the future, addressing people with limited access to healthcare. But unless you can make sure that everybody can access that, it's not going to narrow those health disparities. It's not going to meet the real need. And one of the things that I thought was interesting that people on the panel discussed is it's not just about having broadband, especially when it comes to telehealth. It's about having your own place that's private, right? So going to the library to discuss your health care and maybe, doing telehealth isn't actually optimal or even possible in some cases. And so really thinking about that digital divide in terms of accessing healthcare as well as school and other things that obviously are important is it would be really helpful. As we mentioned, there were funds that went to healthcare providers during the public health emergencies, but they sort of went first to sort of more well-funded providers, basically because we didn't have the data to target financially vulnerable safety net providers. And so figuring out before the next public health emergency, how you might really get aid to the most vulnerable health providers as quickly as possible is something we should be doing now, okay? Expand GME to include nurse training is one thing. We had a nurse shortage through the pandemic. Perhaps using the federal government to help expand nurse training is something that should be considered. And again, as Kate mentioned, we knew that public health was a huge problem. It was clear to the panel that the failure to invest more and carry out advanced planning for future health shocks will really leave the nation needlessly vulnerable to the spread of disease, to hospitalizations, and to deaths. It was beyond our purview to go into which changes to the public health system we should make. And so we basically referred you to other recommendations from other agencies that have been, and panels that have been looking very much at this. So we wanted to make sure that we put our kind of sticker on, like, this is important, but we didn't really get into it. Okay. Policy options related to the lack of administrative capacity and insufficient data. So the closure of the Social Security field offices, which have been mentioned, really hampered applications for benefits. We're not actually sure, and the report kind of goes into a great deal to try to understand how big the effect was on people and whether or not people who wanted to get DI couldn't get it because of the pandemic. That is something, an area still in SSI active research, but clearly it was a hamper for many people. And so we want to prepare that for the next time public health emergency. And again, here, the digital divide is something that can help. So ensuring high-speed internet, improving phone services. Phone services were really backlogged, and providing virtual visits, which in some cases were not possible, might help guarantee no one is left behind. Address the UI technology now before the next downturn. So people have known for a long time that the UI systems need to be modernized. One of the reasons we did, as Henry sort of mentioned, one of the reasons we did the $600 per week instead of just raising replacement rates is because the state agency says there's no way they could program their computers that quickly to adjust that sort of basic parameter of the UI system. And so the only thing they could handle if we wanted to raise benefits was some flat amount, which again, as Henry mentioned, turned out to be quite progressive, but might have other problems with it, including sort of worrying about incentive effects of replacement rates that are higher than 100%, and perhaps some fairness things. When people are working, they make less than when they're unemployed. And also we know that because of the high UI benefits and the expansion of the program to gig workers, there was quite a bit of fraud, and a more modernized UI system would be able to handle that as well. So that we think is an important priority that should be done now, that I think is sort of happening now, and we'll hope it's successful, and really want to make clear that it's very important. And then finally, to improve US data collection, the report notes many areas where a lack of adequate data on health outcomes and mortality by race, health insurance, housing security, and income, race and ethnicity, as well as by occupation, we just didn't know. And that lack of data made it difficult to both appropriately target aid And it continues to make it difficult to evaluate the success of the social insurance system. For example, the main data that are used to calculate the poverty rate really undercount unemployment insurance. And so that makes it very hard. We know that poverty went down by some measures, but we are probably underestimating how much poverty went down, but we don't know for sure. Okay. Finally, I'm just going to really touch on this. It wasn't really something we expected. So the shortcomings related to the effect of the high unemployment and high inflation on Social Security and Medicare. So the high inflation kind of was something that we experienced during the pandemic. We could argue about how much, what was causing the high inflation, but still it was sort of part of the pandemic experience. As Kate said, many people expected the pandemic to worsen the finances of Social Security and Medicare, but that did not. And we discussed the reasons in great detail in the report. But we did sort of notice from the past few years the vulnerability of both Medicare and Social Security to macroeconomic conditions, both the fact that we were very worried that the trust funds would be exhausted quicker because of the downturns. Looking forward, we think that's going to happen more and more. Any downturn is going to make the trust funds more vulnerable, given that the trust funds are getting smaller. And also that things are not perfectly indexed, especially in Medicare, to inflation. And in Social Security, unemployment can actually affect people's benefits for their lifetime. So we have options to modify the Social Security benefit formula when unemployment and inflation are high. We have options to modify hospital and physician payments when inflation is high or higher than expected, which also matters. We worry about people, the early retirement. We did not see people claim Social Security more during the pandemic, but it was quite possible that they could have. And we know that early retirement is not Social Security benefits are not adjusted in an actuarially fair manner. And so you could again have a big downturn that makes early unemployment high and early retirement more likely, that could then lead to lifelong changes in benefits.
Yeah, Louise, thank you again. Thank you to our speakers, Kate, who had to leave, Henry and Diane. We have some questions that have come in that I'd like to pose to you. The first is addressed to you, Diane. It's a data question. Is there data publicly available at the jurisdiction level for SNAP coverage?
Sure. Twice a year, we get information on SNAP at the county level. Every month we get enrollment rates at the state level. We've done some analyses of that, showing that, showing how these changes in policies have impacted both SNAP participation and dollars by the depth of the economic shock, et cetera. So yeah, that's we actually have reasonably good SNAP data because of the great administrative capacity that they have.
And Diane, is it good in terms of racial and ethnic granularity?
It can be, it is good with a lag, racial and ethnic granularity, and they collect and make available to researchers a lot of administrative data that if we did something similar across the other programs, I think we'd get a lot of important research coming out. But it comes with a lag. And so everything we've been able to say so far has either been looking at variation in county level populations, because we've got county level data, or making projections. But in the fullness of time, we'll be able to do much more.
Great, thank you. Louise, this one's for you. Can you talk a little bit about the temporary nature of so many of the policy changes? What are the prospects for any of them surviving to be permanent parts of our social insurance infrastructure? Can't help but be looking at what's happening with Medicaid recertifications around the country. You talk just about that aspect of what did we learn or not learn from the pandemic?
So, I mean, I can address that question, but then I'm addressing it as myself and not as representing the panel. It's not something that we talked about so much, right? So, and so that these programs were temporary, which in some sense, some people might be actually surprised to find out that we let them lag, because a lot of times when you start a program, people they don't lag. And I think the part of our report is to suggest that they were successful and maybe should not be temporary. Certainly on the child tax credit, getting rid of these administrative barriers. So that is not our hope, is that we learn these lessons and reinstate some of these things, or let states experiment with them, and look back and say, these things were very effective. And I think we might see some of that, because as you say, Medicaid is a state has a lot of discretion. And so I think we'll see different things from the states. But the politics of Medicaid are what they are. And so the federal government is no longer paying the higher share, and no one has decided to keep the people continuously enroll. But I think that's also makes sense. Like, it is sort of sad to see people coming off from Medicaid who were enrolled for this long. But at the same time, if you are going to say we are doing this thing to address a temporary problem, and if you never let it roll off, the next time you say I'm doing this thing to address a temporary problem, people will say, no, you're not. It's never going to roll off. So I don't think it's necessary when you enact something that's supposed to be temporary. The fact that it's now rolling off isn't like necessarily the end of the world. What we are seeing, though, is a manifestation of what we talked about in the report, which is that many of the people who are losing the benefits for Medicaid are losing them even though they are still eligible. They're losing them because their paperwork isn't right. They're losing them because they don't realize they have to recertify. These things, I think, are what we really point to. This is sort of public policy that is not, really efficient or equitable, or that's not what we want. If we say people should be eligible for Medicaid, we shouldn't put these minor roadblocks in their way that actually have a big impact on behavior, not because, they don't really need them, but just because they have a big impact on behavior.
Just to make sure that the people who are part of the webinar know that the Academy has undertaken a couple of other task forces that are going to leverage the work of this task force. For example, we have an older worker retirement security task force. They'll be issuing their report, we hope, before the month of July is over. That'll kind of elaborate on some of the points you made, Louise. What was the impact on older workers when it came to unemployment, when it came to claiming for Social Security, came to healthcare coverage? And the focus of that task force is on a particular segment of the older worker population, people in jobs that are physically demanding. They're in the mid 50s to early 60s, too young for Social Security retirement benefits, and not disabled under the very strict definition. What is happening to that subgroup? What are the policy options that could make life less difficult for them? So I want you to know that that's in the works as well. And then all the comments you made about unemployment insurance. We have an ongoing unemployment insurance task force. They'll probably be coming out with something in October, and also reflecting some of the work that this task force did. Henry, I want to give you a chance to weigh in on anything we've said so far, if you're still with us. Yeah, Henry?
I really don't have anything to add, other than that I would like to emphasize that the temporary program that expired, that really is the elephant in the room, is the child tax credit. Enacted during the COVID epidemic, it had a massive impact on reducing childhood poverty. It is something that remains politically very controversial. Many conservative members of Congress are concerned that providing aid without the requirement that parents actually work and earn income is an undesirable message of getting something for nothing, really. I think those considerations need to be taken into account, certainly for political reasons, because nothing is going to be enacted that does not have, and sustained, that doesn't have bipartisan support. But I think it's worth highlighting, although, as Louise pointed out, we did not make it a major focus of our report, that looking to the future, both for normal times and for the crises that will inevitably come, the child tax credit is a very important innovation in the social insurance system. It's in a way, a next frontier that needs to be considered. The Academy may not be in the position of making recommendations, but as Louise said, of some of her comments, speaking for myself, I think this is an area to which Congress should turn its attention. And if they don't, the voters should turn their attention.
Well,
Can I
thank
just
you,
add
Henry.
to
Yes,
that,
please,
because
Louise.
I skipped over this and I shouldn't
Yes.
have. So we actually have sort of two options about the child tax, two policy options. One is just to put back what we put in during the pandemic, make it fully refundable. We talk about the anti-poverty effects, the benefits it had for children. But for people who are worried about, getting something for nothing, we have to have another option that would kind of like make it have some connection to earnings, but make it more generous for larger families, make it more generous for poor people. So as opposed to full refundability, something in between. So just, we do talk about it and we have a few options on it.
I want to just, before we wrap up, go back to a comment that Naomi Stanhouse made when she talked about the perspective of RF Foundation for Aging. And that is that while we as an academy, as I said earlier, just provide options and we don't advocate, we're connected to the world of advocacy. In fact, a lot of the organizations with us today represent grassroots community service organizations and advocates. We're going to follow up with another webinar where we take the policy options Louise highlighted and we've put them into what we call advocacy toolkits, really challenged by RF Foundation for Aging to do that, step out of our comfort zone, so to speak, and really connect more with groups that are able to go and use the power of their constituencies to advocate for change. So stay tuned for that in July. We'll roll out the toolkits so people can see what we're talking about. But we feel that's a great bridge from policy wonkum to let's get real and let's see if we can affect some change that lasts beyond this pandemic. So I wanted to just let you all know that was in the works. Other than that, we're right up to the end. Let me just throw out one kind of left field question, but when you saw the bullet on UI systems, you can't help but ask, what about AI? Is there any way that this fascination with artificial intelligence can actually transform how we administer these programs in a way that's more consumer friendly and reaches people? Louise, is that asking too much of this thing called artificial intelligence?
I mean, it's asking too much of me. I mean, my guess is that there's scope for it, but that's I'm not an informed. It's not. I'm an expert opinion. I have used ChatGPT, but.
Okay, well, stay tuned. We think there's something here that's revolutionary. Well, let me thank all of you again for this very enlightening webinar. Thank you for those of you who've stayed with us. And again, stay tuned for follow-ups. And please look at the report. Please feel free to send questions directly to me. I'll parcel them out, not only to the people who spoke, but we had a stellar study panel, task force rather, that Louise mentioned. So we've got every discipline, every perspective reflected. So we want this to be an ongoing conversation. So thanks again. Hope you all have a very good holiday weekend, and we appreciate the time you've given us.
Thank you.
Bye-bye, everyone.